Hello and welcome, Inspired Podcast community. This is your new episode. My name is Caroline, and my today's guest is Edward Feinberg, and I'm so happy that he said yes to our interview. How are you doing today?
I'm fine. And you?
Yes, me too. We had this little joke before. Okay, and I would like to introduce you to the audience, of course. First, you are a graduate of, how do you pronounce this? Tufts University?
Correct.
Yes. And you practice dentistry for over 40 years and now continue your legacy in Arizona. You were trained by your father, Dr. Elliot Feinberg, a pioneer in full coverage restorative dentistry. You bring decades, or Dr. Feinberg, bring decades of expertise, and you have documented more than 70 years of techniques with over 100,000 photos. You are the director of Onward, an online platform offering over 30 courses in restorative dentistry. You are a recognized lecturer, author of the double tilt precision attachment case for natural teeth and implants, and open wide essays on challenges in dentistry to achieve excellence. You hold multiple leadership positions within the dental community and continue to impact the field through education and service. Welcome to the Inspired Podcast, Dr. Feinberg.
Thank you very much. I'm very happy to be here.
Thank you again, and you recognize yourself. I think it's you. It was your bio, so thank you so much. It's yeah. My first question is: how has your father's pioneering work influenced your approach to full coverage restorative dentistry today?
Well, I grew up in dentistry. I started actually working with my dad when I was a teenager, and I learned everything from him. And my dad also had an amazing mentor, Dr. I. Franklin Miller. And all of the techniques came from the origin of crown and bridge in dentistry in the early 20th century. And most of the profession has veered away from that. And that is what has the track record. So I have a lot of cases that I did in the mouth 30 and 40 years. And I see all my colleagues having difficulty with crown and bridge. And they're having problems with crowns and bridges falling out and recurrent decay under their crowns and bridges. And these problems were solved in the 1930s. And that's very, very sad because the techniques that are being taught violate the basic principles that allowed my dad and I to have so much success. So, what I'm really about in my teaching is basic principles of health and longevity. And what I see is a tendency to concentrate on workflow and economics. And I think that is wrong. And I'm trying to do whatever I can to try and change that. And it's very sad to watch a lot of the technology being developed also violate basic principles that came from dentistry's roots. And most people are unaware of this. Most dentists are unaware of this. And so I think it's very important for me to get out there and try to educate both dentists and patients about things that are true and not true in dentistry and what can be done in dentistry.
I understand, even though I don't understand. It's not my field of education. But you pointed out the importance of education of both the clients and your colleagues. So to say, of course, the experts. And I imagine me as a client, for example, I want to identify a good from a, or differentiate, right? A good versus a bad dentist, so to say.
Well, one of the problems that I see in my field is the overuse and inappropriate use of implants. Because dentists don't have confidence in their crown and bridge skills, they very often recommend tooth extraction and implant placement. And those teeth can be saved. So patients should understand that just because one dentist told them that their teeth can't be saved doesn't mean another one can't save them. And they should question. What I've noticed is a lot of patients they're willing to get a second opinion for a medical diagnosis, but not so much for a dental diagnosis. They kind of do whatever they're told. But some of these invasive treatments that I see at the courses, I'm against putting patients through major restorative changes in a drastic way. I think they should be eased into major restorative changes because that's kind. And that's what I always did in my career. And I think they should be able to offer their patients choices. And I don't see too many dentists having in their armamentarium the choices that they can actually offer patients. So, you know, that saying, if all you have is a hammer, everything looks like a nail. If all you know how to do is implants, that's what everyone gets. And that's what I'm seeing. And I'm against that. I think that's wrong. And I don't think patients should be pushed into any kind of treatment. They should be educated and then helped to choose the option that's best for them. And that's what I try to do.
Oh, I love what you shared. So we have a choice. I did not know this, of course, and most of the people trust what their dentist says in the first place without looking for a second opinion. You would say, right? A second, not diagnosis, maybe. Yes.
Well, yeah, there are different methods of treatment and for solving a diagnostic problem. And diagnosis, hopefully, everyone will make the correct diagnosis before choosing the treatment option that they think would be best. I don't see too many dentists being able to give choices. You know, I go to the lectures in dentistry in my field, and a lot of them are implant lectures. And they show the before x-rays, and I could save all those patients' teeth. And here they are pulling them all out and putting implants in. And sometimes a lot of what's being done is experimental and has no track record of longevity. And you wonder how that's going to hold up. And at lectures, it's rare that any of the presenters show follow up. So you don't even know if those cases worked or how long they lasted or if the patient was comfortable or any of that. So when I show cases, I like to show cases in the mouth 30 and 40 years with x-rays to show that this is what happened. There's very few changes. That was the end of the periodontal disease. This is what I want to show. This is what supports what I'm doing and why I believe in the basic principles that I believe in.
Mhm. Because you have evidence for that, of course. You proved it and you know what you are doing, so you are confident as well that this works. Okay, my next question, I understand. Okay, my next question, what motivated you to create Onward and how has the platform evolved to meet the needs of modern dentists?
Okay. We gave courses in our office. Well, actually, my dad started these courses in 1957, where we would do demonstration on patients in addition to lecture. So we would take 12 dentists, and in 7 Wednesday mornings, we demonstrate every step on a patient how to make a fixed bridge, and another 7 sessions, how to make a precision attachment case. And then there was a need for further education. So my dad and a few of his colleagues came up with the Westchester Academy of Restorative Dentistry, which was an in-person meeting. And we used to get like 100 dentists come to the meeting, and we would be able to go over all kinds of advanced topics and covered that weren't covered in the courses. And then a lot of things changed after my dad passed away. Everything started going digital, and it also became difficult for a lot of dentists to attend evening meetings. That was sort of declining. And then I thought it would be a great idea to move this online. And because I still think there's a very big need for instruction in how to do crown and bridge work. So that's what we came up with Onward. And I really started putting it together when I first moved here to Arizona 6 years ago. So now this site has really mushroomed, and I have like over 30 courses for dentists primarily. But if anybody's interested, they can go there. I have a lot of documents in the documents library, and some of the courses are free and some are, minimal charges because I really want them to get the information, and I'm willing to give special codes to dental students so they can look at all the courses for free. So I really want to make sure that the material doesn't go by the wayside, because I have seen that where with advancements in dentistry and medicine, and they went by the wayside because the mainstream didn't approve of them, or you couldn't sell a drug, or you couldn't sell an instrument, and this is wrong, and this is not how you advance scientifically, in my opinion. So that's why I think it's important to continue. So I have a few colleagues that help me with the website, and so we try to make it better. I'm now trying to update some of the courses because some of them are 5 years old, and so I'm in the process of doing that.
Oh, and that will be a lot of fun, I assume, to
It,
do the courses.
it's a lot of work putting the pictures together and making the recordings and the handouts and the quizzes is a lot of work, as any teacher knows. Putting courses together, it's difficult, but if I was practicing full time, I couldn't possibly do this.
Yes. I'm very happy that you created this platform. That way you can reach more people also all over the world.
Yes, and that's exactly right, because the Westchester Academy of Restorative Dentistry was confined to a small geographic area. And this way, now it's opened up to anybody all over the world. And I think that's fantastic.
It is. I love the new opportunities with the medias as well. And then you can connect the people, all the dentists in the world, of course. And you talked about that you gathered, if I can say this, or you invited 100 of your colleagues and then you had this meeting. Or yeah.
Oh, yes, that was in the old days. Now, we can get people from all over the world. It's completely different. And the hardest part is marketing, is the hardest part. I think that's true for anybody who wants to get their message out there. But I feel I have a very important message that needs to be heard. And it's very, very hard to uh, buck the powers that be. There are a lot of corporate interests that don't want my message out there because they want to sell implants, for example. And that's one of the things that's fueling the overuse and inappropriate use of implants.
Mhm. I understand. And when I imagine that the tooth is you said they draw or you draw the tooth out, then it is gone, right? You cannot. Yeah, I mean this is the purpose of restorative dentistry. You said, but
Well,
if I imagine as the client, then and when they diagnose the wrong one, and it's
well,
like
you
a
see,
nightmare.
dentists don't have good crown and bridge skills. So if they see, let's say, a tooth that's flush with the gum, um, they they feel those things can't be restored. And I do those teeth all day long, and I don't build them up, and I don't put posts in them, and I don't do a lot of crown lengthening surgery on them, and I don't do fancy orthodontic procedures, because they're all trained to hang their crowns off of whatever's sticking up above the gum. And I don't care if there's anything sticking up above the gum. I care about what's below the gum. So my techniques, I go all the way down and I get a good grip on the root. And when you look at my x-rays, you could see that the crowns almost look like they're sitting on the bone. They're not, of course, because the body wouldn't accept that. But I have brought all the forces up close to the bone and minimized the forces on the bone. And very often, if the patient had periodontal bone loss, that's the end of it. And nobody can tell that that patient ever had periodontal bone loss. So these are really good basic principles that are not being taught and followed by 99% of dentists. That's scary because what I'm doing comes from dentistry's roots.
Yes, and I love how you how you implemented, so to say, the word roots, because it also had to do with teeth. I love this vocabulary, you know. It's
Yes, a
not
dental pun.
my mother language, so I can play with the words here. Thank you so much for sharing. Of course, I have another question for you. Let me see. With your decades of experience, what do you believe are the most critical skills for dentists to master in crown and bridge work?
Well, I would say the basics, the basic principles and the basic philosophy, or I guess you could call that a paradigm that's being taught in dental schools is incorrect. And that's where a lot of their problems stem from. And I have a pretty good evidence. I have 70 years of evidence for the basic principles of what I'm doing, and that should be promoted. That's one of the reasons why. And then another thing is that a lot of dentists come out of school and they've been indoctrinated in a certain way of thinking, and they're not open to learning a different way of thinking. That's scary, but that's the way it is, and it's the way it is in a lot of fields too. So then once they get out, they you can't reach them. That's very, very difficult. And there are very, very few people who want to sit down and take the time. You see, now one of the problems too with that, as long as you mentioned it, is that uh, dental students are getting out of school with huge debts, like $500,000 in debt, and now they're going to first start their career. Do you think that they're concentrating on building their knowledge and skills, which is what they should be doing? They're worrying, how are they going to pay back these debts? So they get hooked into a production mindset, and you can't be any good that way. You have to do things with a quality mindset, and that may take extra time. And as you become better, you become faster. That's what I had. I had the best mentor you could have. And I started out, that I had no time constraints put on me so that I could develop quality skills. And then as I got faster, then I could concentrate on production. But that's not what's happening. And I think a lot of dentists get stuck working for these big managed care mills, and they never become good. They never like the profession, and they never give anything back. And I don't think this is a good direction, but that is what I see going on.
Mm. I see your passion, and I also love that you mentioned paradigm and mindset because, yeah, and that the students coming from university have a closed mindset. They are not open to learn something not new to them, a better way, right? Let's say, let's put it that way. It's a better way.
Well, what's very interesting is I gave a presentation to the University of Texas in Houston, and there was a mixed audience. There were half of them were the dental students, and the other half were practicing dentists. And I got very mixed reviews. I got great reviews from the practicing dentists, but the students thought I was the worst thing since sliced bread because I was showing things that went against what their teachers were teaching. And that is unfortunate, but I know that what is being taught is incorrect, and it's very hard because dental schools themselves are political institutions, and outsiders are not welcomed into their arena most of the time. I wouldn't say all the time, but most of the time. And so they are not taught that your education begins on the day you graduate, or that's not emphasized. What should be emphasized is we showed you a way. Now, this is not the only way, or not necessarily even the best way to do things. That you will have to continue your education when you graduate. That is the attitude that they should have when they graduate, because even the best school can only give you a very rudimentary foundation. And then advancements do occur. And if you don't keep up, you're going to be left behind. And especially other areas of dentistry like endodontics and orthodontics have made huge strides over the course of my career. And you can't keep doing the same thing that you learned in dental school. You will be left behind. And so I look at a lot of technology. I'm not one of those Luddites. but I look at that new technology through the lens of basic principles. Does this fit in with what I believe in? And some technology is really good technology, like scanning and milling. And there have been advancements in laboratory techniques with technology that have been improvements, like laser welding is a big improvement over torch soldering. So if I see something that I think is an improvement, I'm all ears. I want to do better, and but a lot of it violates basic principles, like crowns in an hour. You know what that is? Essentially, the end product is an all ceramic crown, and when you prepare a tooth, you usually prepare the teeth with a ledge on them, and then the ceramic crown goes to the ledge. There's always an opening on a microscopic level because bacteria are microns. That was known in the 1960s when they attempted to do the same thing, baking the crowns in an oven with high fusing porcelain. That is the exact same thing. And now this is being pushed by these companies that make the $100,000 machine that they want dentists to buy. When I make crowns, they're made on the model of the mason jar cover, which is the best known thing ever devised for food preservation. That can't be done with a ceramic restoration because in thin sections, ceramic breaks. And so you have to have something stronger that can go under the gum and seal the whole root surface. So that's the difference. And so butt joint dentistry was never good dentistry. And interestingly, they just made a robot to do this, to prepare the tooth, make the all ceramic crown, and put and insert it in the patient. And some poor soul sat for this, and they want to sell these machines now and let the machine be the dentist. But this is never, the butt joint dentistry was never good dentistry. And yet now the profession is being conditioned to think that that's good dentistry and that's acceptable and it's modern. And it's not. It violates basic principles, and they're not going to get the same degree of success that my dad and I got.
Yeah, I understand. So it's about the basics. You told us that, and then I did not know this, but I remember when I last time I was at the dentist, then he showed me a machine where I don't know what he I think it was a bridge or something. It was it was
I'm sure
produced.
that's what it was. I'm sure that's exactly what it was. And yet this they don't know the difference. They don't know what this is really, but I size it up in 2 seconds because of my background. But it's very hard to get anybody to listen to me because, first of all, economically, it's put something in 1 day and not have any laboratory costs, and it's very lucrative. So I'm most interested in health and longevity, and everybody is being focused on workflow and economics, and this is wrong, and this is the wrong direction, and somebody's got to say these things, and I guess it has to be me. So I'm very vocal about what I believe in.
I love that. And I love your passion about it. And this is why you are here and we are here for our inspired podcast, of course, to take inspired action as well. And my last question to you is about your goals. Do you set goals for yourself or intentions? What is one of your next projects?
Well, my goal is to make an impact in my profession and help raise the standard of care in full coverage restorative dentistry, both natural teeth and implants, because both have a place. And I've done a lot of implants myself since they first came to our country in the early 80s. But I know that they have to be handled properly, and the experts have said how these should be handled to manage biomechanical stress, and that is not being done. A lot of things are being violated. I have a lot of answers to restorative problems, but I'm not getting enough ears to listen to me. And having difficulties with manufacturers who want to discontinue products that are very, very important to do quality dentistry. And so I have my work cut out for me to try to make an impact. When you're going upstream and everyone else is going downstream, that's a very difficult place to be. And um, how do you reach people who are not open to what you have to say? That is a problem. And so this is one of the things that I have to deal with. But I feel I'm right, and it's very important that my voice is heard.
Absolutely. I totally agree. Thank you so much for sharing. Of course, I have to ask you where we can find you or when people reach out to you. Yes, how can they do this? How can they support you?
Okay, my website is www.theonwardprogram.com. So onward, Onward, program.com. And I also have a book of essays, which were the blogs on my website, called Open Wide, appropriately, which is available on Amazon. So those are the two ways you could visit my website. Encourage dentists to take the courses and to take a look at it, because this is unique. They won't find anything like this anywhere. And they will learn a great deal. It could change their practice life completely, because I'm able to save teeth that very few people could save. And if you can do that, you'll have people flocking to you, because people come to dentists to save their teeth, not to have extractions and implants. And so that should be a last resort, except in a few circumstances. It should be a last resort, not a first resort, in my opinion. So if you have good skills in implants and good skills in crown and bridge and good skills in bonding, you can pick and choose which treatment choice is best for each patient, because there is no one size fits all. And a lot of times you have to think outside the box in order to come up with something that's going to really help people, and also have a contingency in the event that something goes wrong, so the poor patient isn't up the creek. And that's very important thinking. And that's when I do treatment planning, that is what I try to do. If this tooth goes or if this implant goes, does the patient have to do the entire case over? That's important. And I have some contingency plans that I can do in case those things do happen.
Wow, I love that. Please reach out to Dr. Feinberg. He has information not many people have, and he's willing to share and teach us and educate. We can call it that way, of course. And you have a beautiful website with programs. I put it in the show notes, of course. Thank you so much for our interview. I learned a lot. And now it's time for your final thoughts to the audience, please.
Well, I hope that uh, the audience, both dentists and patients, will better themselves. At least if they're educated, not to accept whatever's told to them, but to ask questions, find out, and then take their time in making a decision that's best for them. That's pretty good advice. That most of dentistry, there is no emergency, and you can take your time to figure out what is going to be best for you. And don't be afraid to seek other opinions and figure it out. That would be a good message.
Yes. Don't hurry. Yes, that's a good message, and get a second opinion. And I love that so much. Thank you for our interview.
Oh, you're welcome. Thank you for giving me the opportunity. I appreciate it a lot.
And see you in the next episode.